I am Nanampofoje, a diagnostic medical sonographer, and today I'll be taking you through vascular ultrasound. Most importantly, the lower extremity arterial Doppler. Sometimes it's quite confusing because most sonographers find it difficult to interpret the waveforms. Now, let's begin. One major question that we always ask ourselves is, why does blood flow? So, as a sonographer, you should be able to understand the hemodynamic aspect and then the anatomy. Okay, so once you understand the basic principles of blood flow, then you are there to go. Okay, so why does blood flow? Energy created by contraction of the heart pushes blood flow around the body, and then that energy depends on two factors. Okay, one, there should be energy to drive the blood flow, and then two, the resistance across the vessel or the vascular system. Daniel Bernoulli explained the concept of energy, and then Poisili also explained the concept of resistance. Now, today, we will focus more on the Bernoulli's principle and the stenosis. What happens when there is stenosis? According to Bernoulli, the law of conservation of mass says that even though there is a change in velocity, the volume of blood flow that is entering a narrowed portion here, okay, must be equal to the volume that is exiting it, and that is Bernoulli's theory. So let's look at this vessel here. Blood is moving from point A to point B, but it got to this point where there is an obstruction or an atheroma along the vessel wall. So the blood flow to this area is limited. Okay. Now that leads us to what? The continuity equation. And explains that flow is equal to the velocity and then the cross-sectional area of the vessel. So look at these two vessels here. Okay, there's area reduction here. And that is what Bernoulli is saying, that if there is area reduction, as we are seeing here, it should be accompanied by what? An increase in velocity. So at the point of stenosis here, we are going to see what? An increase in velocity. Okay, the peak systolic velocity is going to increase. All right. Okay, so let's see. Flow is directly proportional to velocity times the area. That is 1. So velocity is equal to the flow over the cross-sectional area. What this expression means is that if the velocity increases, the flow increases, velocity is going to increase, but the area is going to what? Decrease. That is what we are seeing here. A decrease in area what results in what? An increase in velocity. So if, let's say, it is a common femoral artery, okay, where we know the velocity to be 115 or 14 plus or minus 25 centimeters per second, and then you place your sample gauge here, okay, and then you had a velocity of, let's say, 200 centimeters per second. It should tell you that there's a problem that is going on. Are we getting it? Okay. Now, there's an atheroma along the vessel wall here. There's meaning that the area is going to what? Decrease. Okay. Once there's area reduction here, velocity is supposed to increase. Blood flow from area of higher pressure to area of lower pressure. Okay, so here we have the direct and indirect signs of stenosis here. Before the stenosis, from point A, before we got to this point is what? Proximal, that is pre-stenosis. And then after the stenosis, what? Post, after. So post stenosis. Okay. Now, for the lower extremity arterial Doppler, we know that it is triphasic, as we have here. But before the stenosis, we are having a normal waveform, triphasic. Okay, we have a normal waveform. Now look at intrastenotic point here. At the point of stenosis, sample volume has been taken. The pulse wave, look at the velocity. Okay, because a decrease in area results in what? An increase in velocity. So you, at the point of stenosis, expect an increase in the velocity rate. Okay. Now, the lower extremity vessels, we know them to be high resistance flow. Okay. And then they are high resistance, and mostly they are all triphasic. The heart contracts to provide the initial pressure wave, and that is what you are seeing here, the peak systolic velocity here. And then the second waveform here, early diastolic flow reversal, is the pressure wave that is reflected from the high resistance distal vessel bed, and then it travels back the artery. And then the third one is what? When the artery contracts, and then energy is stored in the vessel wall. Okay. So that is that. So it is triphasic 1, 2, and then 3. But as the disease progresses, we have, this is our spectral window here. Loss of this one as it progresses, second one, and then we have a monophasic flow. Okay. This is a normal lower extremity arterial waveform. So let's just look at how nicely it is. Okay, so 1, 2. Okay, so that is that. This is the closure of the aortic valve. So for normal flow, we are not expected to see filling in of this spectral window. The peak systolic velocity should be within a normal range for all the vessels that we know. Now let's look at Bernoulli's principle and then stenosis. Even though we know that monophasic flow is abnormal, but this monophasic flow, as we are seeing here, is not abnormal. This is a normal triphasic waveform, and then this hyperemic monophasic flow. Okay, monophasic hyperemic flow. Mostly we see this waveform when there is vigorous exercise or when there is an infection in the lower extremity vessels. Mostly you see this kind of waveforms. The fact that you are not seeing a triphasic and then you are seeing this waveform doesn't mean it is what? An abnormal waveform. So you also take care of that. Now we have monophasic flow, we have biphasic, we have triphasic flow. When we take this vessel here, let's use this waveform to explain Bernoulli's principle. This is a normal triphasic waveform, point A. At point B, we are supposed to see what? A high increase velocity here. Downstream stenosis, we saw this waveform. So mostly at the point of stenosis, the kinetic energy increases, the pressure drops, right? But after stenosis, the pressure regains strength, but the flow rate becomes what? Very slow. So in most states, we see a monophasic flow. So this is telling you that there is a significant stenosis upstream. So look at it here. We are seeing a bridge here, a color flow here, and then telling us that there's a significant what? So mostly monophasic waveforms, we see them downstream what? Stenosis. So once you see something here, just check upstream, and mostly you see an abnormality along the vessel wall. Okay, now let's look at other waveforms too. Here, we already stated that before stenosis, here, we are going to get or have what? A normal triphasic flow. At the point of stenosis here, the peak systolic velocity is going to what? Increase. So look at it here. We have around 240 centimeters per second. That is very high. And then just look at filling in here. Of the spectral window. A disturbed flow, telling us that there's what? A disturbed flow. Okay. And then look at point this one. We said mostly it is seen what? Downstream to a highly significant stenosis. Look at it here. There's no flow around this point at all. Okay. So your waveforms, you'll not be able to see anything here. So when doing arterial, low extremity arterial Doppler ultrasound, factor the velocities, know the normal waveform here, and mind you that at the point of stenosis, intrastenotic point, the velocity is going to increase substantially.